15 million people have received a first dose of the coronavirus vaccine, a huge achievement for all involved.
The government has reached its target that it set itself to have offered jabs to everyone in the first 4 priority groups by today. Health Secretary Matt Hancock joins us now this morning. Good morning to you, Health Secretary. Thank you for joining us this morning. It is some achievement what the government and what NHS England has managed to do to roll out this number of vaccines and also to do it ahead of time.
Yeah, it's been amazing. The team have done an amazing job. 2 days early, as you say, ahead of time, and a big team effort. And I'd also thank the volunteers who are doing an incredible amount of this. It's been a big team effort right across the board, and really good to see such a large proportion of people coming forward. You know, over 9 in 10 of over 70s have now had the jab, which is frankly much better than I expected, and helps us all to be able to come out of this safely.
Now, of course, you are right to be smiling about that, but it's our job to also look at the other bits, the not so triumphant bits as well, and look ahead to what next for the vaccines. So what we need to do, don't we, is to roll out the next stage just as effectively. Questions over supply for that. Are you confident we've got enough? We need to reach sections of the community that aren't coming forward. What are your plans to deal with those things?
Well, you're just like the Prime Minister. You know, well done. Now, what next? And it's the right question, and it's exactly how we think of it as well. So the next phase is that we want to offer the jab to everybody in groups 1 to 9 by the end of April. We've got the supplies, we think, to be able to do that and to start the second jabs, which will start in earnest next month, because we've got to make sure we have the supplies for those, because they are all booked in at a specific time. But also, as well as offering the jabs to all these groups, and even despite the very high take-up that we've seen so far, we've got to keep driving that take-up upwards. We've got to reach all those who, for various reasons in care homes, haven't been able to be jabbed yet, because you can't be jabbed within 28 days of testing positive. So there's a whole load of people we need to reach there. We need to drive up uptake in, as you described, in harder to reach groups where uptake has been higher than it has with other jabs in the past, like the flu jab. But we've still got to reach more people. And given that 15 million people have now had the jab, I think everybody can see that it's safe. We know that it's effective. So if you're in one of those top 4 groups and you haven't yet taken up the opportunity, then please come forward. And we're going to be doing a whole load of work to try to increase that take up amongst the groups we have offered to, as well as expanding the offer.
Matt Hancock, we're seeing this morning that 4/5 of NHS staff have had their jabs, which is one way of looking at it. But of course, that's 20% of them that haven't been able to have it or haven't had it for some reason. Do you know why that 20% is lacking that jab opportunity?
Well, there'll be a number of different reasons. The first is that you can't have the jab within 28 days of having tested positive, and so for all those who've tested positive, obviously that means that they have to wait until they can have the jab. We know that has had an impact. The second is the logistics. We have been doing this on hospital sites to make it as easy as possible. But we've got to make sure that we make it as easy as possible. And then the third is just the confidence factor. And as I say, we've seen this very high uptake. But we've just got to persuade people that it's the right thing to do for them.
Does that surprise you, though, that the staff that are working for the NHS, you're saying that there's a confidence factor in this, when they can see, you'd think, front and centre, exactly the devastation that COVID does cause to vast swathes of the population, that they're nervous about having the vaccine, that they don't see that that's our way out?
Well, I would stress the other 2 reasons as well. We've just got to make sure that we do have that programme demonstrating the importance of having the jab right across the board. It's obviously in the NHS, amongst social care workers, and amongst the population as a whole. As of Today, we've now written out to over 1 million of those aged between 65 and 70 to invite them to come forward. So for every group, this positive message of the jab's effectiveness is really, really important.
Now, vaccine, a vital part of getting the country out of lockdown and moving forward. We're expecting the Prime Minister to detail his roadmap for that next Monday. There's still the ambition of getting schools back on the 8th of March. It was suggested that prioritising teachers, giving them a vaccine over half-term, would have been a good way to make that 8th of March more likely. Why did you not do that in the end?
Well, we chose not to do that because the prioritisation of who gets the jab in what order is all about saving the most lives. And those who are aged over 65, which is the next group, they are much more likely to die than the under 50s. We've seen this very, very strong correlation between your age and your likelihood of dying with COVID. So that the clinical advice is crystal clear about that, and therefore we've stuck to following the clinical advice. Of course, I understand and I agree with the need to get schools back as soon as we safely can. But the good news is that we have largely through this pandemic not seen a particularly higher rate of infection amongst teachers, and that schools themselves are safe. The challenge with schools has been that they have contributed to the spread, but thankfully we are seeing the number of cases coming down, and crucially, we very much hope and expect the vaccine to break the link from the number of cases through to the number of people who end up in hospital by protecting those who are at highest risk.
I'm not sure if you could hear our last segment just before we came to you, but we had, amongst others, the Imperial College Professor Neil Ferguson joining us, epidemiologist who has been advising the government with his modelling as well. And when he was asked by Kate as to what the biggest miss from the pandemic so far, and we all understand that it has been a very, very quickly moving landscape, he said the biggest miss was the lack of control over the rise in infections in autumn, and we should have locked down sooner in autumn, and there was a lack of political consensus at that time to do that. Do you agree with that? Do you think that has been the biggest miss? And is there political consensus now with the strategy to getting out of this lockdown so we don't have to go in again?
Well, the goal, of course, is to come out safely and in a sustainable way, so that we don't have to go in again.
So
and that's the
Professor
debate.
Ferguson correct? Was that the biggest miss?
Well, what I care about is getting things right in the future. And so this week we'll be having the discussions for the final decisions as to the roadmap that's set out, that the Prime Minister is going to set out.
He did imply, by the way, that you were one of those that did want the lockdown. And if people had listened to you and Boris Johnson, it might have been different. So will you get your way this time and have more caution? Will you be able to control it more? Because it looks like that those that might have argued against you turned out to be wrong.
Well, of course, we've got to learn from everything that's happened and make the best judgments we can in the circumstances. The difference this time is that we now have this vaccine program that's gone so successfully, and we can see there's only 2 other countries in the world that have gone faster than us: the United Arab Emirates and Israel. Israel have published a huge amount of data on the impact of their vaccination program, and you can see it having the effect we'd all want to see in reducing hospitalizations and deaths. We want to see that here as well, and that is different to last time because we haven't had the vaccine in large scale before, and we have managed to give that first jab to the most vulnerable.
I was trying to give you the chance, Mr. Hancock, of saying you were right, the others were wrong. So full marks for loyalty.
That's very kind of you,
but it doesn't make us clear if there's going to be consensus and people are going to listen next time in those discussions you're having this week. Do you feel confident they will?
Well, I feel confident that we'll come to the right answer based on all the evidence that we have, based on the discussions that we're going to have this week. It's a team effort being in government. The vaccine rollout is a team effort right across government. and the NHS, of course, and armed forces and councils and others. Making these decisions is a team effort, and then we all go out and explain the decisions that we've collectively made.